Hello and welcome to the Stem Cell Healing Institute podcast. In case you have any questions, please send us an email to info@stemcellhealinginstitute.com. Thank you and enjoy the podcast. Hello and welcome to Stem Cell Healing Institute video podcast. We are here with Dr. Zahra Figueredo. She is the technical and general director of the institute. How are you, doctor?
Very well, Louise. And how are you today?
I'm doing great. Thank you for asking.
Great.
We do have a very interesting topic today, which is pancreatic disease and how the stem cells can help. In this case, doctor, can you give us a bigger picture of what is pancreatic disease?
Yes. So pancreatic disease can be considered an umbrella term for many different conditions that can fall under that. So we have pancreatitis, we have pancreatic cancer, we have, you can even consider diabetes a pancreatic disease because it originates in the pancreas. So basically, the pancreas's main functions are the production and release of digestive enzymes for the purposes of digesting carbohydrates, proteins, fats, and fibers to some degree, as well as the production of insulin for blood sugar control. So when there is any kind of malfunction in those aspects of the physiology, we consider that to be due to the pancreas, or we can call that pancreas disease.
Doctor, so what is pancreatitis?
Pancreatitis is specifically the inflammation of the pancreas. When we hear itis, that always refers to inflammation. Now, what is inflammation? Inflammation is the immune system reacting to some sort of injury causing swelling and pain. And so if it's on the surface of the skin, it can result in redness and again sensitivity and pain on touch. And that's what we refer to when we hear pancreatitis. Now, what can cause pancreatitis? And I'm sure you're probably going to ask me, Louise, so I'll beat you to the punch.
Yeah, that was going to be my next question.
Yes. Is usually it can be caused by alcohol or a very high fat diet. Very more often than not, it's an alcohol usually combined with the high fat diet. And what tends to happen is the enzymes that the pancreas produces for the purpose of digestion tends to somehow, because of injury to the pancreas itself, those digestive enzymes tend to start affecting and digesting the pancreas itself and leading to further malfunction and further discomfort and further pancreas disease.
So, doctor, as far as the stem cells, what is their mechanism to heal a pancreas?
Yes. It's really important because what happens is any damaged tissue, whether it's the pancreas or the liver or the heart or the brain even, for that matter, when there is a damaged tissue and that tissue the cells break open and release a cytokine or a chemical messenger. These are inflammatory markers that literally signal to the stem cells in the area. So the stem cells will be floating around IV, intravenously, or also locally in the area of the injury. And those cytokines specifically signal to the stem cells that this is where the damage is, because those cytokines are specific for that damaged tissue. And so it's a very, very phenomenal physiological phenomenon where the stem cells know exactly where to go when there's damaged tissue. And so that's what we rely on when we do an IV and when we do local injections. We may, very likely what we do very specifically and very uniquely at the Stem Cell Healing Institute is we'll apply the stem cells intravenously, but we will also apply them locally so that they're just closer to the site of injury. And that just makes for better results.
Do you do this by yourself, or do you do it with any other physician?
Oh, yes, we have a team of specialists that are specialized in their respective fields. So, of course, we have our anesthesiologist, we have our orthopedic surgeon and hematologist who helps with bone marrow extraction. And then we have our microbiologists in the lab, and then we have our endocrinologists. So, yes, absolutely. We have a team of specialists.
So I will have to ask you, if you do this treatment for pancreatic disease, can those stem cells also help just in case you have any other issues like kidney failure or something like
Kidney
that?
and liver. You know, it's really important to note, Louise. I'm glad you asked me that question because when we have pancreatic disease, very often it can be secondary or primary to a liver or a kidney, and almost always, if it's gone long enough, we will see all three organs. It will see detrimental effects on all three organs because they all work so closely together for digestion and detoxification and so on and so forth. So we have the liver that deals with um, uh, basically detoxing the fat soluble um, nutrients or fat soluble toxins in our blood. And then we have the kidneys that deal with water soluble toxins. And then we have the pancreas that deals specifically with digestive enzymes and insulin. And they all work so closely together with the whole digestive tract that very often than not, we see all three organs involved in some sort of not failure, but when one is involved, the other ones are probably taxed to some degree.
And I don't mean to make a commercial here, but you're pretty famous of doing follow-up on your patients, right, doctor?
That's right. It's really important to me that I not only track the progress of my patients, which is super important in what we're doing and how we can improve things, which we are constantly improving on our techniques, but also just providing that human touch in letting them know that we're here in case they need anything or they have any questions or concerns or anything that may arise, any sort of support that they may require. So we make sure that we're available to them at all times.
I wanted to ask you, doctor, what is the rate of success in this type of treatments?
We have with all of our stem cell treatments, we have had 100% success rate.
Wow.
I'm very happy to report. Now I need to ensure that I'm not misleading our listeners and viewers because 100% success rate does not mean that we're curing everyone to 100% of a degree. What I mean by that is that we have seen every patient see some degree of positive change or positive increase of quality of life, whether it's 20% or 80% or 100%. We have seen every single patient see some degree of positive result and increase in quality of life.
And I know you mention it in almost every podcast, but I think it's important to let our audience know that you do a very comprehensive treatment that includes other type of therapies, right?
That's right. And that is very, very important to us as a clinic. And I believe that's what makes us so unique and also aids in our top-notch results is that we treat the body as a whole. And we ensure that we're addressing every aspect of well-being, including detoxification, including hormones and various different factors, as well as oxygenation of the tissues, key herbs and minerals in order to address any sort of deficiencies, as well as key supplements. And then, of course, psychological and emotional well-being. We round it out by addressing that as well.
And one of my final questions, doctor, will be are these treatments safe? Because there's such a lot of bad information out there about the stem cells.
That's right. And thank you, Louise, for asking that, because a lot of patients or prospective patients, yes, a lot of people, they hear stem cells and automatically they assume, oh, embryonic cancer, they've been acquired unethically from killing babies and so on and so forth. That's really important to address here, because we don't do any of that. We do not use embryonic cells, which can potentially cause cancer. They have not been deemed safe yet in the corrective way, in the manner in how to use them. But also, we use only adult mesenchymal stem cells, which come from either umbilical cord, endometrial cord cells, bone marrow, or adipose derived. So it is always adult mesenchymal stem cells, not embryonic. And in most cases, we like to use autologous stem cells, which are coming from the patient's own body, and grown with brand new, non-toxic, produced from scratch, very viable, high numbers of stem cells, which is our own proprietary technique. So we're very proud to offer that.
Interesting, doctor. Can you also tell us your demographics, where your patients, most of your patients come from?
Luis, that's a very interesting question, because most of our patients here in Guatemala, when they come for treatment to Guatemala, they come from North America. And I would say that would make up about 80 to perhaps even 90% of our patients, because this treatment is not available in North America.
I was going to ask you that.
Canada has completely outlawed stem cell treatments. There's just no inkling of stem cell treatment in Canada whatsoever. In the US, there's a version of stem cell treatment, very, very limited scope, because it's just not approved. And if it's done, it has to be done in one day, in one setting. The stem cells have to only come from the patient's own body. So that really limits results. They can't be combined with anything else. So here in Guatemala, we create a very, very powerful cocktail of stem cells with exosomes, with growth factors, and other proprietary ingredients. In the US, the stem cells are not allowed to be combined with anything. They can't be grown, so you're only limited to a certain number. And that, again, that very much limits results. So that is why most of our patients are from North America.
Doctor, is there anything else you would like to add to this podcast?
I think we've covered a lot of ground, Luis. I'm sure you will do the great job that you do and add all of the social media information at the end of this podcast.
That is correct. By the end of this podcast, you will find all the information, how to contact Dr. Figueredo, and how to follow us in all our social media. So, doctor, I wish you a wonderful afternoon, and I will see you next week.
Thank you, Louise. I look forward to it. Take care.
Bye-bye. Thank you for listening. In case you have any questions, please visit our website, stemcellhealinginstitute.com. Or you may send us an email to info@stemcellhealinginstitute.com. If you want to contact us from North America, you may dial +1 209 690 7836. If you want to send us a message through WhatsApp, please add us at +502 4220 7297. And this is how you find us on our social media. On Facebook, Stem Cell Healing Institute. On Instagram, Stem Cell HI. On Spotify, Stem Cell Healing Institute. On YouTube, Stem Cell Healing Institute. We hope to hear from you. Thank you.